Welcome to This Explainer. Today we're diving into, well, probably one of the most intimidating words in the human language, right? Cancer. But look, instead of fear, we're going to arm ourselves with understanding today. We're going to explore exactly how this disease actually operates, and honestly, more importantly, how modern medicine fights back.
Here's our roadmap for today. We'll be hitting the cellular rebellion, classifying the threat, detection and diagnosis, the modern treatment arsenal, and finally, life beyond cancer. So let's just jump right in.
Part 1. The cellular rebellion, when normal cells go rogue. All right, so we're starting at the microscopic level. And the biggest thing here? We need to frame cancer not as some, foreign invader from the outside, but really as a diverse, internal rebellion of our own biology. We've got to shatter this common misconception that cancer is just one single disease. It's actually not. It's a group of over 200 unique variations. And each of these is driven by abnormal cells that basically just refuse to stop growing. They actively invade nearby healthy tissues, and they have the dangerous potential to metastasize, which means spreading to distant parts of the body. Because there are over 200 types, they literally require incredibly distinct and highly specialized approaches.
Now, you can really see the stark contrast between health and disease here. A healthy cell, it plays by the rules, right? It replicates its DNA, undergoes controlled division, that's mitosis, it repairs itself, and if it's damaged beyond repair, it undergoes apoptosis. That's essentially just programmed cell death. But on the flip side with cancer, DNA mutations have caused a total loss of control. These cells just don't die when they're supposed to. And they even trigger something called angiogenesis. That's basically the process of building their very own blood supply just to feed the growing tumor. Wild, right?
Think of these hallmarks as basically the ultimate survival checklist for these rogue cells. For these cells to become a true threat, they have to sustain their own signals to multiply. They actively evade the body's natural growth suppressors, and they resist cell death completely. They actually achieve replicative immortality, which means they can just divide endlessly. And like we just talked about, they induce angiogenesis to steal nutrients, eventually activating the exact mechanisms that let them invade surrounding tissues and metastasize. It's really a complex, multi-step biological rebellion.
Moving on to Part 2. Classifying the threat, categorizing the 200-plus types.
So, how do medical professionals actually make sense of all this complexity? Well, they categorize the major classifications based on where the rebellion actually starts. For instance, a carcinoma arises from epithelial tissue. That's the lining of organs. This is why your common examples are lung, breast, and colon cancers. But that fundamentally differs from a sarcoma, which originates in connective tissues like bone or fat. Then you've got leukemias, the blood cancers, lymphomas affecting the immune system, and melanomas, which arise from the pigment-producing cells in our skin. Understanding these categories is absolutely crucial because, a carcinoma behaves and responds to treatment totally differently than a leukemia does.
But how do we actually know when one of these specific rebellions is taking place? It's super vital to recognize these general warning signs. Think of this as your body sounding the alarm. We're talking about things like unexplained weight loss, persistent fatigue, or maybe a cough that just simply won't go away. Now, obviously, a lot of these symptoms can be caused by everyday, harmless conditions, sure, but they're also clinical red flags that really prompt the need for professional medical investigation. Catching these symptoms early is heavily emphasized by global health guidelines. All right, Part 3, Detection and Diagnosis, Identifying the Enemy.
Let's transition into the crucial phase of clinical action. Once that alarm has been sounded, how does modern medicine actually detect, confirm, and evaluate this cellular threat? Well, here's a fact that offers immense relief to a lot of people. Not every tumor means cancer. Distinguishing between a benign and a malignant tumor is the absolute first diagnostic priority. A benign tumor is non-cancerous. It stays localized and it's rarely life-threatening. A malignant tumor, on the other hand, is true cancer. It's invasive, it damages local tissue, and it carries that really dangerous capability of metastasis.
To make that critical distinction, doctors follow a very definitive diagnostic pathway. It starts pretty simply with a medical history and physical exam, followed by lab tests that check tumor markers and organ function. Then comes the advanced imaging, your CT, MRI, or PET scans, to actually get a look at the body's interior. But step 3 is really the heavy hitter, the biopsy. Taking a physical sample of the tissue to examine under a microscope is the absolute gold standard for getting a confirmed diagnosis. And today, this is almost immediately followed by step 4, molecular and genetic testing. This allows oncologists to practice precision medicine by identifying the exact DNA mutations that are driving the tumor.
Once there's a diagnosis, doctors have to map out the progression of the disease.
They do this using what's called the TNM staging system. That stands for tumor size, node involvement, and metastasis. So stage 0 means the abnormal cells are totally localized, or in situ. Stage 1 is an early, small tumor. By stages 2 and 3, that indicates the tumor has grown and actually begun regional spread into nearby lymph nodes. And finally, stage 4 means distant metastasis, so the cancer is spread to entirely different organs.
Now, this brings us to a really common point of confusion. What is the difference between staging and grading? You'll hear these terms thrown around together all the time, but they mean completely different things. Staging measures the physical spread of the cancer in the body, like where is it and how big is it. Grading, on the other hand, is done under a microscope. It measures how aggressive or abnormal the cells themselves actually look. So a low-grade tumor looks closer to normal tissue and grows pretty slowly, whereas a high-grade tumor looks wildly abnormal and grows very rapidly. Both of these metrics are absolutely vital when deciding how to fight back.
Which leads us to part 4, the modern treatment arsenal, multidisciplinary counterattacks.
Okay, let's dive into the incredibly sophisticated, multidisciplinary arsenal that oncologists are using today. The days of a one-size-fits-all cure, those are long gone. Successful treatment today is rarely just one method. It's a highly personalized, combined approach. So you have the traditional pillars, right? Surgery for direct tumor removal, chemotherapy for systemic cell destruction, and radiation therapy using targeted energy beams. But the modern era has brought in incredible advancements like immunotherapy. This actually uncloaks the cancer cells and boosts your own immune system so it can destroy them. Then there's targeted therapy, which attacks specific genetic mutations inside the tumor itself. And alongside all of this, you have palliative care, which ensures the patient's symptoms and side effects are expertly managed throughout the entire process.
Let's see how this multidisciplinary approach actually plays out in a real-world clinical scenario. Consider this hypothetical timeline for a woman diagnosed with early-stage breast cancer. At month 0, routine screening flags an anomaly. By month 1, a core biopsy confirms the diagnosis and clinical staging is established. In month 2, surgical intervention removes that localized threat. Over the next few months, she'll undergo adjuvant therapy, like chemo or radiation, just to eliminate any microscopic rogue cells that might have been left behind. And by year 1, she steps out of active treatment and right into rehabilitation and survivorship. This seamless flow from detection to recovery is the ultimate goal of modern oncology.
And finally, part 5, life beyond cancer, survivorship and prevention.
You know, the conversation really doesn't end when the tumor is gone. We have to focus on what happens after treatment and how we can proactively reduce risk on a global scale. True survivorship requires holistic, compassionate care that goes way beyond just eradicating the cells. Treatment side effects, things like fatigue, neuropathy, muscle loss, these require intensive physiotherapy and nutritional rehabilitation. And the mental toll? That demands robust psychological support. Plus, modern survivorship care heavily factors in a patient's overall quality of life. We're talking fertility preservation for younger patients, helping people confidently return to work, and providing long-term monitoring so we can quickly catch any potential recurrence.
This brings us to what I think is one of the most empowering questions we can ask in this entire explainer. With all these complex cellular mutations and genetic factors, how much control do we actually have over this disease? Like, can it actually be prevented?
Well, the answer, according to the world's leading organizations like the WHO and the American Cancer Society, is a resounding yes for many types of cancer. Now, sure, we can't control our genetics or aging, but adhering to these proactive lifestyle choices dramatically reduces your overall risk. Quitting smoking, getting vaccinated against cancer-causing viruses like HPV and hepatitis B, maintaining a healthy weight, protecting your skin from UV radiation, and honestly, most importantly, participating in evidence-based routine screenings for breast, cervical, colon, and prostate cancers. We actually have immense power to tip the scales in our favor here.
We're going to conclude this explainer with a really powerful synthesized message from global health experts. Look, cancer is complex, but it is no longer an insurmountable mystery. By understanding the science and really leveraging modern medicine, there is incredible hope out there. But I want to leave you with a critical question to ask yourself today. With so much of our risk directly tied to the lifestyle choices we make, what small change will you commit to right now to tip the cellular scales in your favor?